Welcome to today's mental wellness workshop, Surviving Grief, Loss, and Trauma, Strategies for Self-Care, Mental Wellness, and Resilience. My name is Shahidra Koval, and I'm excited to share virtually at today's conference. I would like to thank the organizers and leadership for inviting me to share and be a part of today's event. Today's topic is relevant to the times we are living in, and it's vitally important for us to discuss as an application of self-care how we push through during this pandemic period um, as individuals, as parents, as family members, as caregivers. This information is also extremely relevant to helping professionals, first responders, healthcare providers, advocates, chaplains, really anyone who has experienced loss, trauma, or grief over these past 2 to 3 years. In this presentation, we will discuss and activate strategies that I hope will help you change your self-care plan from a reactive response approach to a more proactive response to your own ongoing wellness. We will talk about the nature of grief and loss, the differences between trauma and grief. We'll define what traumatic stress is, and provide examples of what that looks like and the lingering effects of traumatic stress, as well as discuss a few interventions that are useful in the treatment of grief, trauma, and loss. We'll also turn the corner and talk about how to maintain wellness, specifically tending to the 6 zones of self-care, along with some key strategies to building resilience. I invite you to take notes, write your questions down, and my prayer is that you get the piece that you need to help move you forward in this area. At the end, I will share my contact information, and if you have any specific questions that I can answer for you, I am available for that. So let's jump into today's talk. I want to start with a few qualifiers just to confirm that you're in the right place. Each of us has a story that is unique to our life experiences, especially over the past couple of years. The trials you have endured and overcome, the pressures that have at times felt overwhelming, the sacrifices that have had high costs. Your story is uniquely yours, and we all have one. Welcome to the club. Over time, with support, prayer, and resources, you learn to put these life experiences into perspective, and you may feel like you've dealt with them. The cumulative toll of these life experiences during a crisis period, meaning the COVID-19 pandemic that we've been living through, can be exacerbated during times like these and can sometimes overwhelm your capacity to cope. When life is unmanaged with a resiliency plan, a wellness plan, it can lead to psychological crises, health issues, relational struggles, and more. We have yet to see the full psychological impact from this, and we will be discussing outcomes and research, I believe, from this time for years and years to come. So I want to share this. So on the screen, you see common losses. Loss is the antecedent to grief, and we've all experienced some degree of loss during this time, be it from employment and job changes or income changes, our loss of independence and freedom, loss of the future, loss of endings, loss of physical activity due to the quarantine, even loss of social interaction and a social life, has been limited around our communities. And then finally, even the loss of events and celebrations, even including funerals. So I want you to stop and consider which ones have impacted your life. Maybe the one that's impacted you is listed. Maybe there are others that come to mind. But what I want you to understand is grief is a natural and normal response to loss. There are various stages to the grief process, and your grief reaction may manifest itself in one or more of the following ways. You may have physical reactions. Sometimes people who have physical reactions to grief say things like, I feel sick to my stomach. I just can't eat. I feel short of breath, weak. I have a heavy feeling in my chest. I have trouble getting to sleep. And after I finally do, I only sleep for a few hours before I'm up again. Those would be physical reactions to grief. Sometimes people have work reactions. These reactions manifest in their occupation or their day-to-day work life. And they'll say things like, I can't seem to get organized. I'm up and down 100 times during the day, here and there, never seemingly able to accomplish anything. I keep thinking I'm losing my mind. Those may be work reactions. Emotional reactions may come in the form of just emotional pain, feeling sad, low, depressed, anxious. Someone dealing with emotional reactions may say things like, I'm never spontaneous anymore with my friends. It's so painful and sad. And I burst out crying or get angry so unexpectedly or uncontrollably. Many times the reactivity and the emotional reactivity comes out of the blue, right? And then finally, spiritual reactions are very common in a grief process where a person may verbalize or think, if my faith were stronger, I would be able to handle this. Or if I really believed, this wouldn't have happened. So grief can take on various different forms, and there is no time limit. There is no right way to go through grief. How you go through it is just how you go through it. And many times people assume that grief is a straight linear line. That's how we want grief to work. We want it to be smooth, easy, let's get this over with. But in actuality, grief is pretty messy. Many times we'll go through grief and experience shock. We may experience numbness, denial, anger, anxiety. One common stage of grief, especially when it's a traumatic loss, I tend to call it the searching or the investigation phase, where you are looking through phone messages, pictures, listening to voicemails, going back through emails, and seeing what things you missed or what portions were important to you that maybe you should have feel like you should have responded to in a different way. You may also go through this phase of being disorganized, feeling lonely, isolated. You may also experience overwhelming guilt, depression. Um, can all be a part of the grief cycle. Um, and of course, as you go through this, the goal is to get to acceptance. But even if you get to acceptance, there may be periods of time with anniversaries, birthdays, holidays, where you cycle back through the grief process. And that's perfectly okay, and it is normal. Um, Sometimes people lump trauma into the grief process and can't figure out why they are stuck. They will describe trauma symptoms um, such as, I don't want to fall asleep because of the nightmares, or I don't want to go anywhere because I'm triggered every time I get into my car and I'm fearful of a panic attack. And so they'll describe these trauma symptoms and verbalize it as grief. However, when the loss is sudden and unexpected, like I mentioned before, traumatic, there are certain distinctions that we start to recognize that are just different than the process of depression or grief, the grief process. So what is traumatic stress? Traumatic stress. Traumatic stress is a normal reaction to an abnormal event. Some examples of traumatic events that may bring on a traumatic reaction may be any of those that are listed here and many others that are not, but I'll read a few of them. Rape or attempted assault, or sexual assault, physical assault or violence, combat, if you've served in the military of any sort, would qualify. Witnessing another person's death, experiencing a natural disaster, During this pandemic period, our nation has experienced a number of other natural disasters during different seasons. And of course, the pandemic qualifies as a natural disaster as well. Any type of accident or severe accident that brings on a serious injury, unexpected death of a loved one. I believe during this period of COVID-19, there have been over 870,000 deaths due to COVID alone, or those are estimated values. So that, as well as sudden medical illness, right? Domestic violence or abuse, childhood neglect or abuse. Both of those have skyrocketed during these past 2 years. The numbers of children that have been at home under a loved one's or a parent's care, or not having a parent available to care for them while they were quarantined due to a parent having to work. So many scenarios that fall under that. Work as a first responder or emergency medical personnel or healthcare provider. There are just known occupational hazards that come with that line of work. Any type of traumatic loss, active shooter events or terroristic attacks, and of course, repeated exposure to upsetting details of someone else's trauma, also known as vicarious or secondary trauma. Common physical signs of traumatic stress. I always like to throw this list up on the screen just to give people an idea of the range of signs that can come due to trauma. And you may see that these are a little different than the grief reaction responses. Some of them may be in alignment, but many of them are specific to traumatic stress. Physical signs may include headaches, upset stomach, heart rate increases, like your heart begins to race. It may be reduced coordination, extreme tiredness and fatigue. Nervous shaking may fall under some of the physical signs of traumatic stress. These reactions can be present immediately following a traumatic event in a form of an acute stress reaction. There can also be a delay in onset of these symptoms, which can happen after the 48-hour mark or more. For first responders, sometimes this may be an onset after several weeks, after 2 or 3 weeks, and it may seem out of the ordinary or uncommon for why you're having the reaction. But it may be specific to a recent traumatic event that you've experienced. Cognitive signs of traumatic stress may be as follows: constant worrying, racing thoughts, not being able to focus, not using good discernment or making poor judgment, being negative or pessimistic. Other cognitive signs of stress may be confusion. You may have a shortened attention span. You may not be able to attend to information as soundly as you may have in the past. You may struggle with memory. Your logical thinking may be decreased. I already said impaired decision making, but you may also have a decreased self-awareness. Okay, so those would be a few cognitive signs of traumatic stress. And then emotional signs of traumatic stress may, again, this kind of falls in line with the grief cycle as well: depression, anger, guilt. All of those could be a part of grief as well, but they are also significant during traumatic stress. And this is kind of where that intermingling and intertwining of reactions may be confusing for people in trying to understand the difference between trauma and grief. Numbing, feelings of isolation, helplessness, anxiety, denial, fear are all common signs of traumatic stress reactions. And then finally, behavioral signs of traumatic stress. Um, some behavioral signs consist of um, loss of interest, um, not wanting to talk or being more quiet or silent, more so than usual, exhibiting more nervous behaviors such as fidgeting and pacing. You may also have an increased hypervigilance. That just means that you're on guard, constantly watching for something bad to happen. Um, you may also withdraw and be isolated. And why I wrote on here, it's very dangerous. During these times, what we know through the research and what helps people, what has been reported as helping people the most, is staying connected. And so when withdrawal and isolation become your coping strategy, you lose that opportunity to be lifted up by others, to be cared for, heard, even if it is just that person sitting in silence. There's value and many, many benefits to having relationship and people who are willing to walk with you through the trauma journey. You may also experience changes in your appetite. Um, you may eat too much. Many times it is a craving for sugar and salt, or you have no appetite at all. And so either end of those extremes could be a behavioral sign of traumatic stress, as well as maybe procrastinating and avoiding responsibilities. And then lastly, be mindful that an increase of use of alcohol, drugs, cigarettes can also be behavioral signs of trying to cope with and manage the reactions of the stress and the trauma that you've just experienced. It's important to recognize that grief and trauma do have lingering effects when there um, is no intervention. Individuals who have experienced trauma can have a variety of these. There are a number that are listed. You may not experience all of them, but you may experience one or two or multiple. Trauma can fundamentally shift the way we think, the way we feel, and what we do. Um, and I guess that statement could fall true for grief as well. So some of the lingering effects, and we're talking about these effects being reactions to maybe stuck grief or stuck trauma over time, not addressing the reactions and the um, the signs over time can turn into more lingering effects. Some of those lingering effects may be addictive and habit-forming behaviors. It may be on the more extreme end of depression, suicidal thoughts, or self-injurious behaviors. It may be experiencing problems with authority. It may be also finding difficulty establishing healthy, trusting relationships with others. It may involve even difficulty with forgiving yourself and others. Um, there are many opportunities that can allow people to stay stuck, but I like to mention these just so that you have an awareness of maybe when may be a good time to get support. In the beginning, I mentioned spirituality. Sometimes with the lingering effects, there may be a questioning of spirituality and your faith beliefs, um, changes in how you respond to others and how others respond to you. You may also struggle with work problems or family relationship issues or conflict with friends and roommates or neighbors, spouses, coworkers, people that maybe previous or prior to the trauma that were good support to you, but you've maybe fallen away from those relationships due to recent conflict as well. There is hope. Support and interventions are available for grief, trauma, anxiety, depression, and really any adverse life experience that you've gone through. You do not have to go through it alone. Mental health support is trending. This pandemic period has nearly eliminated any stigma associated with seeking mental, behavioral, or psychological support. Talk therapy, support groups, coaching, pastoral care, chaplain care, AA meetings or NA meetings, animal assisted therapy, all of these are opportunities for you to get support. But here's what I want to say. You must deal with the trauma and grief before you focus on mental wellness maintenance. You can't skip over the trauma and the grief and just focus on um, the six core elements of staying well. It's counterproductive. And it can almost set you back in a sense if you don't do the work, um, because you're trying to rush through to get to feeling better. The sooner care can be implemented, the better, and it's never too late. Post-traumatic stress is manageable and it's treatable. One of the therapies that I recommend to my clients who are living with emotional pain and reactivity from trauma or traumatic loss or traumatic grief is a therapy called EMDR. EMDR stands for eye movement desensitization reprocessing therapy. So you may be asking, what is EMDR? Maybe you have heard about it. Maybe this is the first time that you're hearing about this type of therapy. Nonetheless, EMDR has been around for over 30 years and is one of the most researched therapeutic modalities available today. It was originally developed to treat trauma, but over time, research has shown that it is beneficial for really any adverse life experience. Simply put, EMDR changes the way the brain stores information and how the body responds to emotional triggers. This is a therapy that must be administered by a trained or certified EMDR therapist. It can be done as an adjunct therapy or as an intensive treatment, specifically towards things like trauma or phobias. That means if you already have a therapist who you love and have a wonderful relationship with, you can still keep that person on board. However, if they are not an EMDR provider, you can still get the specialized support to treat the trauma. Um, so how does it work? EMDR really is initiated by an initial consultation or an assessment. During that time, the therapist learns about the trauma or the multiple traumas that have occurred um, that are causing the most distress or are evoking an emotional reaction. Um, these may be symptoms that have been present for a long time. A little bit ago, we talked about the lingering effects of trauma. There may have been signs of this event causing long-standing issues by those long-standing lingering effects. So that initial appointment really is to educate about the nature of trauma and to teach a little bit about emotional regulation strategies prior to that initial intervention therapeutic session. Um, in an intensive, that next session really does begin the therapy, and that opportunity to target whatever memories, whatever was brought up during that initial assessment, become the targets for the EMDR work. Um, And ultimately, what happens during a session is a client will be asked to go to one of the most difficult parts of that memory. And the therapist will either do eye movements, use hand pulsers, or ask them to do some tapping on their legs or on their shoulders to activate the bilateral stimulation. Once that is done, the client is then asked, what is coming up for them. And usually There are specific events, specific memories. The vividness of the picture is usually very prevalent in the beginning. As the therapy goes on, the intensity of that image, the intensity of the reaction begins to diminish because of the processing and because of the structure of the EMDR session. Um, it's important to know, again, that EMDR has been around a long time. Like I said, there's a lot of research behind it. It is an accepted treatment by the American Psychological Association, the Veterans Administration, the Department of Defense, the World Health Organization, as well as the U.S. Department of Health and Human Services, all recognize this as a valid form of treatment. Like I said, for any adverse life experience, but especially for trauma. So let's talk a little bit about what resiliency is. When adverse situations arise and a person's resilience is low, they may be more vulnerable to depression, stress, anxiety, and even interpersonal difficulties. And I want to be clear, resiliency is not that you just bounce back. Resiliency is usually after there is an adverse event, a stressor, a trauma, a hardship that happens, that resiliency becomes that capacity to allow you to move forward. Okay. Resiliency can be taught, it can be learned, it can be nurtured and developed over time. And according to the theory behind resiliency, the research says that that energy to get back up, that energy to bounce forward, comes from a supernatural source or a spiritual source. Okay. When you're vulnerable, you are more likely to use maladaptive strategies to compromise your health. That may compromise your health and cause you to engage in behaviors that prolong the stress instead of reducing it. So resiliency comes in handy when you can learn the healthy strategies to activate when those adverse situations happen, because life happens, that you know what to do, how to do it, when to do it to allow yourself to move forward. Um, Poor psychosocial functioning is linked to poor physical health. Okay, for example, hypertension, persistent fatigue, migraines, even autoimmune diseases have been well documented in relation to heightened levels of anxiety, depression, stress, and even sleep disturbance. And so we're going to take a minute and talk just a little bit about ways to settle your mind, your body, your spirit. Um, and there are multiple ways to promote resiliency through these methods. Okay, so the American Psychological Association recommends focusing on four key areas that build resilience. And those four key areas are connection, wellness, healthy thinking, and meaning. Now is the time to be a guardian of your health and well-being. You can't afford not to be. Um, the prolonged pandemic period has led to our healthcare systems being overwhelmed, stressed, and divided. So you must take really good care of yourself. These are 6 zones of self-care, primary areas that I, I, I believe require intentional routines and are at the core of most wellness programs. Um, these areas of self-care are physical self-care, professional self-care, relational self-care, emotional self-care, psychological self-care, and spiritual self-care. Okay. And when in a maintenance cycle, there are methods and routines that can be utilized as a preventative measure to keep yourself well. Many of these suggestions you may already be familiar with, um, but some of them may be things that you may consider adding to your wellness care routine. Okay. Learning ways to settle your mind, your body, and your spirit are important. And there are various ways to do it to promote resiliency. You're not just locked into one or two ways. I think in our society, we have, and there's nothing wrong with these methods, but many people that will say, you know, I do yoga or I do Tai Chi or I do um, Eastern medicine, Eastern based type of activities to promote wellness. Um, there are such there's such a wide range of ways to do this. Finding a way that is most beneficial to you is the key, right? You get to develop your own self-care plan, but it's also important to know that there may be alternatives available to you if you are looking for different ways to activate wellness. Okay. One of the ways to do that is through what we call a wellness and resiliency training program. With wellness and resiliency, it is an intentional focus on building knowledge around um, what things will be helpful for you and to give you a sense of direction if there are maladaptive strategies on how to change those strategies into more positive ones. And so, wellness and resiliency training is very valuable in helping to change your mindset and helping to restructure your wellness plan so that it is more conducive to life and ongoing wellness. Okay. The second thing is being able to use arts and creativity to spark vision and raise awareness. Sometimes when we think about psychological self-care, we think brain training, we think counseling, we think um, uh, 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 different ways of promoting, you know, purpose. Um, but using arts and creativity, like I said, can spark vision and raise awareness in a way that may not naturally be evoked, and it may not be the first thing you think of when you think about psychological self-care, but it definitely is a good option. Nurturing your faith and spirit, we'll talk about that here in just a minute. But your support network, again, the APA recommends that we focus on connection. So understanding who the key players are in your support network, who are your people who have your back, whose back do you have? All of those things help to harness connection and being able to communicate with others who may be on the same journey, who may be further along the journey, or you may be helping them along on their journey. So connection is really important. And then the last thing I would say is consistent follow up with either peers, coworkers, family members, spouses. Um, these are all keys to sustainability and growth of any wellness and resiliency program. Making sure that you have some accountability with the plan that you've established and that there is follow through. Okay. On the screen right now, you see linking physical, relational, and emotional self-care. So my disclaimer is that I'm not a medical provider. I am a licensed counselor, but I don't hold a medical degree. So some of these recommendations you may want to check in with your doctor and do your own research to see if it will benefit you. Um, how we link physical and emotional self-care um, may come in the form of recognizing that mental health is one component of overall health and well-being. And when this bidirectional relationship is activated, compromised physical health and routines can affect one's mental health. And then vice versa, when mental health issues are prevalent, physical health may also decline. So, for example, researchers have recognized that there are key health contributors to heightened prevalence of depression in the Western society that we live in, which includes being overly stressed, overweight, having poor dietary nutrition, being vitamin D deficient, um, not getting enough movement, so physical inactivity, sleep deprivation, and relational disconnection. Okay, so all of these things are what can contribute more to depression. And I just gave you just a snippet of the things that should be a part of your wellness and resiliency plan that are natural antidepressants in a way. Um, One of the natural antidepressants that I think is vital, but can also be paired with relational self-care is physical activity. The research says that aerobic exercise, moderate intensity exercise are really great for your physical well-being in your body, getting some movement every day. Um, the most bang for your buck, if you have the capacity and the strength to do it, comes from high intensity interval training. Um, and all of them have proven to um, be most beneficial in reducing stress, anxiety, and depression. And although they are all effective, like I said, the HIIT workouts, high intensity interval training, tend to show the most benefit. Um, like I said, when pairing the relational, the emotional care, the physical care with other things, you can start to see the benefits across the board. And so for some people, they may struggle with working out alone. And so getting involved in some type of social fitness, even if it's small groups, even if it's just walking with a friend or taking a class that you do on YouTube or doing um, a Peloton ride, all of these things kind of evoke some level of social fitness. And these activities may influence camaraderie, closeness, and increase social connection. The next thing I'd like to recommend to enhance resilience is intermittent fasting. Okay, again, not a medical provider, but there are some really wonderful benefits that come from giving yourself and your body periods of rest and time to heal. Okay, recent research has talked about the gut-brain axis and the biochemical connection between your gastrointestinal system and the central nervous system. And there are many benefits that come from recognizing that what we eat and how we manage our nutrition and our wellness and our rest periods has an impact on our mental health. When the flow between these two systems, again, the gastrointestinal system and the central nervous system, are unhindered and it's regulated due to limiting food intake, um, in certain durations and periods, but also increasing water consumption and then healthy nutritional intake during feeding periods will help reduce inflammation. It will cause weight loss, so your weight decreases, which can also reduce mood-related issues such as anxiety, depression, and stress. The other benefits are that you could get the benefit of increased mental clarity and it boosts your energy. Other physiological benefits include a decrease in insulin levels. Insulin is connected to a lot of health issues. It can increase metabolism and regulate your hormones. Um, One of the books that I like to recommend, if you want more information, is Dr. Jason Fung's book. I believe it is called um, The Guide to Fasting. I'm probably getting the last part of that wrong. Yes, it's called The Complete Guide to Fasting by Jason Fung. And at the end of this talk, I'll be sure to um, include the slide that offers resources that I've accessed for this presentation, including The Body Keeps the Score, as well as Jason Fung's book. So at the end, if you missed any of that, there'll be a slide at the end that allows you to see some of the resources. And certainly, last but not least, added to that list just with resiliency. We want to be intentional about our spiritual self-care. Remember, it's the primary source of supernatural energy that you need to recover and to promote resiliency. Some ways to do that. Um, Again, these are suggestions, but depending on your faith background, your belief systems, you adapt them as needed. However, prayer, meditation, devotional readings can all be helpful. Bible study, spiritual fasting, whether corporately or individually, can be beneficial. Praise and worship, listening to praise and worship music, singing praise and worship music can help spur your faith. Attending church, fellowshipping with others, volunteering, giving back, and even spending time in nature can be all ways that we nurture our spirits. Another wonderful option for improving your resilience is getting support. These are just examples of things that we're doing at our counseling center here in Little Elm, Texas, and Dallas-Fort Worth Metroplex. We offer mental wellness checkups, and these checkups are basically preventative wellness strategies that allow us to check in with people and to give them recommendations on ways to continue to stay well. But it's also kind of a checks and balances to see which areas may be vulnerable. These wellness checkups are done, every 3 months, every 6 months, or annually, and follows more of a medical model. Um, it it is not built into our mental health care system to do these regularly. Um, Unfortunately, most people don't seek out a counselor unless there is a crisis or major struggle. Um, but these type of interventions become helpful in helping a person maintain wellness. Um, Mental health checkups, I'll say just a little bit more. Mental health checkups have the potential to help nearly any person take better care of themselves. More routine mental health checkups could reduce stigma by normalizing and integrating the mind with the body in a real and tangible way. The overall purpose is to reduce the risk for mental health crisis, increase access to support, and increase resiliency. Okay. Um, EMDR intensives for trauma. Now more than ever, we need flexibility in how we get support. I do offer adjunct EMDR therapy in the form of intensives to reduce trauma symptoms in a shorter time span. It can also be used to treat specific phobias. Um, but typically, this is an extended session that can be done during a day, or it can be done over a weekend. So I usually tell my clients we can deal with this, over 3 to 6 months, or we can deal with this in a few hours. And many of them want that freedom, from the trauma reactions of the symptoms. And so intensives are safe. Um, they are validated by research, and they are convenient and less time consuming. So. And then the last thing we do at our center is something called restoration wellness retreats. And this goes along with our mental wellness checkups. We offer these anywhere from every 6 weeks to every 2 months to give our attendees, our clients, an opportunity to hit the reset button. And so they come to our office or to a designated site to address the 6 zones of self-care. And it is a really good time. We do resiliency training, and it is just a great benefit for our attendees to have the social connection, the camaraderie, but also to gain the advantage from having accountability and support and regular check-ins um, that allow them to continue to stay well. Like I said, these are offered every 6 weeks to every 2 months, but depending on what a person needs, they may come every 3 months, they may come once a year, they may come every 6 months. And this is open to the public. It is not just limited to our clients. So if you are ever in the Dallas-Fort Worth area and you're around here during one of our wellness retreats, we definitely would love to have you. Finally, last but not least, these are some of the resources that I use to develop today's presentation. All of these resources have been enhanced over the pandemic with providing information, free information online about mental health support, resiliency, trauma, and where to seek help. If you are local to Kansas, you may find local providers by going to websites like Psychology Today, or accessing your insurance provider network or directory to find providers in your area who may be able to help you with the mental health and EMDR standpoint. Here's how you can connect with me. My name again, Shahidra Koval. It's been a pleasure sharing with you today. My counseling center is Fundamental Foundations Counseling Center. We have 3 locations in the Dallas-Fort Worth area, in Little Elm, Allen, and Dallas. Our website is there. You can follow me on Instagram. You can send me messages on both Instagram and LinkedIn at Shahidra Koval. Our counseling center is also on Instagram, as well as Facebook. I believe we're under Fundamental Foundations Counseling on Facebook. I also invite you, if you do have questions from today's talk that you would like to ask, you can definitely send me an email or reach out to me by any of those other means. Thank you so much for your time and attention. God bless.